Public health officials are warning that COVID-19 infections may increase in severity as the latest subvariant known as Kraken spreads in Canada. And according to Public Health Ontario, the subvariant is most prevalent in areas surrounding Hamilton last month. Eric Viano has more.
This graph from Public Health Ontario shows the estimated growth of the variant across the province in recent weeks. Public Health says Niagara had the highest number of cases from December 4th to December 31st. 18 residents tested positive for the Kraken subvariant. And Niagara Region's acting medical officer of health says that number is likely higher now.
PHO did some modeling to show what they would see happening, and their prediction was around the third week of January, so pretty much around now, XBB.1.5 would likely become the dominant variant.
However, Public Health Ontario's December data is the latest we have.
So we don't actually know what the current situation is because those results that are collected from people who are tested this week are still going to be processed for a couple more weeks before we know the variants.
Meanwhile, last month in Hamilton, Kraken, which is the XBB.1.5 variant, made up only 0.3% of cases.
It's not entirely clear when that might or if that will result in an increase in the trajectory of the COVID activity we are seeing. Currently, right now, COVID activity does remain high in the city of Hamilton, but we have seen a decrease with our recent data in recent weeks.
Public Health Ontario data also showed that Haldimand, Norfolk, and Brant County had the highest number of infections in the province. Infectious disease specialist Dr. ZAIN CHAGLA says Kraken's high presence in areas surrounding Hamilton stems from its presence in the eastern United States.
First detections of XBB.1.5 were in New York State, and so not unsurprising that the areas bordering with New York State are the ones that are seeing the earliest transmission.
CHAGLA says he doesn't think Kraken is going to be as bad as previous variants.
I think from our early indications from the US, more transmission, more pressure, but not certainly at the level of prior explosions like when Omicron first came about.
Meanwhile, the federal government provided its first COVID-19 update of the year today.
While XBB variants are expected to increase in Canada, it is not known whether they will become the dominant lineage. Nationally, the absolute number of cases is not surging at this time, nor is there evidence of increased severity with this or other new variants.
The federal government says Canadians should continue to get booster doses in response to subvariants. Eric Viano, CHCH News.